Hello, Neuro Club. My name is Madeline McGill, and I am the OT Neurology Fellow.
And I'm Jacqueline Machado, and I am the Neuro PT resident. Very confusing.
They make it confusing for us.
Yeah.
So we are excited just to tell you a little bit about the programs that we're in and why we chose them and just some information about it to see if any of you may be interested in applying for one in the future. We have our emails on the slide that they presented in the club, so if you have any questions, feel free and email us. We'd love to be able to answer specific questions that you may have. So first off, Morgan was so sweet and sent us some questions. So we'll just kind of go through these and we'll be bouncing back and forth on answering them. But if something kind of jogs your mind, just go ahead and, like I said, email us. We'd love to hear from you. So the first question was just why did we choose a residency or fellowship? What sparked our interest or what motivated us to apply? I know for me specifically, I didn't hear about fellowships in OT at all until Creighton developed one in neurology. So I was like, oh, that's a huge interest of mine, something that I was really looking for in a future job. And then knowing that this had a component of teaching as well. Long-term career goals for me is to go into academia, so I loved having that experience right away out of school to have the teaching with the clinical experience. So that was a huge reason that I was motivated to apply. And then just really getting that deeper knowledge was a huge aspect of it too, rather than just kind of going into your first job and being totally on your own. We kind of get a lot of extra mentorship throughout that. So that would be for me.
So I think Maddie hit on the main points of why I kind of chose it. I wanted to do something with the neuro population since undergrad. So when I think it was Dr. Barr who first talked about it during PT school, I was like, yeah, I'm probably going to end up doing this, still trying to keep my mind open, but that didn't really help. So I ended up in it. In general, I just wanted to know like the most effective and efficient ways to help these individuals. They've suffered something pretty great, and even though they have years to get better, you know, there is that specific time of like neuroplasticity where we need to target the most appropriate interventions, and I just felt like a residency was going to give me that knowledge. I also think that, I don't know, with Creighton, I was also looking at the teaching component, not necessarily because I want to be a teacher. I don't think I'm that great at it. But I think that in order to fully understand something, you need to be able to explain it to others, including your patients. And so I really looked at that with Creighton, and even though it was being uncomfortable a little bit, I went for it, and I'm glad. I've been doing great. And I think in general, too, like, the compassionate component that Creighton had for us and the Ignatian values that I knew they were going to continue to instill in us and the service-oriented approach, I thought that was all very important to me. So all that plus more neuro, can go wrong.
Yeah. That's awesome. So the next question was, what does your typical week look like? And that's a good question, because sometimes it's different. But just the four basic components that we both have in our programs are, one is the clinical aspect. Yep. We are both at Emmanuel Hospital right now, and the both of us will, within the year, will go through inpatient rehab and outpatient rehab at Emmanuel, and then we both will spend some time in ICU and acute care over at Bergen Mercy, Creighton University, Bergen Mercy Medical Center. So we'll get to be at both places, but most of the time is spent at Emmanuel Medical Center. And then we both already mentioned that there is a teaching component. So teaching a few lectures, developing a lab experience. We also have both spent time as a lab assistant. So being in the labs, helping students, getting that encouraging the students to get that hands-on experience has been really fun to kind of walk with them, and being new grads ourselves, it's awesome to be able to kind of know what they might be thinking a little bit more, because we are not that far removed.
Things are rolling.
Yes.
So better.
Do you want to talk about the next couple?
Yeah. And so then teaching, and then the research component too that we have. We were given the opportunity to do kind of a research project throughout the whole year that will be presented to faculty and then possibly submitted for like a conference like CSM. or something of that nature.
Or AOTA.
Or AOTA.
Or NOTA, NOTA, or OT.
So we have that too that we're supposed to kind of intertwine into all of our other, clinical and teachings. We are also given the opportunity to do some outside service. So we're both doing individual things on that. We'll be giving a couple presentations as well and a manual for continuing ed courses. And then also, I think we both have a similar education component. It's a little bit different. For the PT side, I'm a part of the Neuro Consortium, which is run out of Los Angeles at Rancho Los Amigos. And it was a weekly thing for about 2 hours, and we had different instructors who would kind of go through a little bit more in depth some of the topics that we talk about in normal classes. So, for example, one was like vestibular rehab, one was cerebellar rehab, and having like a full 2 hour in-depth lecture of how to best perform this practice. I think, Maddie, you have something similar?
Yeah, so the way that we do it in OT, this goes for the other programs too. We're Neuro, but there's also additional residencies and fellowships that you can look into outside of Neuro. I don't know why you would, but you could. But anyway, we have what are called specific modules. So different practitioners and hospitals or clinics or some faculty mentors at Creighton would create a module on spasticity or a module on vision therapy. So you read resources, there's learning objectives that you have to complete or learning activities, and that's how we can continue to gain that deeper knowledge. And then additionally, we also have a common curriculum where it's all PT and OT residents and fellows at Creighton, which there are 11 of us this year.
There are 11. Small office.
Yes. So once a week we meet together for an hour and a half and just gain deeper knowledge on a specific topic that's relevant to both of us. Like we've talked about exercise in the brain, we've talked about motor control theories, and the
even
list goes
ethics
on.
And I think that was another big aspect of Creighton that I think really led me to it too. I was really worried that I was going to get all these great neuro skills and my orthopedic skills would kind of drop off, which, I mean, I'm not going to lie, they probably have a little bit compared to the ortho residents. But at least, having that time to discuss different cases and, seeing what their clinical reasoning was during some of them, I think has also just broadened my knowledge and made me not forget about that we're treating the whole person and not just the impairment. So, it's been cool.
Yeah, so next question is, how do you think that this enhances your practice versus if you did not do a fellowship or residency? And I think we've touched on a lot of things, just the great experience that we have, but one thing we haven't touched on is we both have direct mentorship in the academic setting and also in the clinic setting. So we were kind of talking about how this really expedites your clinical reasoning because you're going to do something, but someone's going to be asking you why you did what you did, what was your thought process behind it, what deficits or impairments did you see that led you to do a certain intervention or perform a certain assessment. So it really forces us in a good way to think about why we're doing what we're doing. And then just always having someone to bounce ideas off of has been super helpful as a new practitioner to recognize, again, why you're doing what you're doing. So that's been great.
Yeah, I know my mentor, when I have him kind of observe how I'm doing things, he always finds something that maybe I didn't think of or I haven't seen before. A recent quick example was ideomotor apraxia. I had never seen it before. If you don't know what that is, you'll learn about it. But it's just something you don't see a ton. And so it's something I didn't really think of. And he immediately pointed it out to me. And I was like, oh, I'm an idiot. You're totally right. So it's been nice to kind of have that component. And I think Maddie pretty much said it all. My clinical reasoning and pattern recognition were really escalated. Not to say that if you didn't do a residency, you'd be a bad PT or OT by any means, but it's just been nice to kind of have those expedited skills and thinking process.
So the next question is, why did you choose Creighton over other programs? Because there are other programs out there. And then also, what's the criteria for applying to Creighton's fellowship or residency program? Well, for one, I think we both loved Creighton and just didn't really want to leave because we know all the great faculty and staff, and we know that it's just a really high caliber university, first off. And then with the criteria, both the criteria for OT and PT were very similar. have to pass your boards, have to have 3 letters of recommendation, fill out application questions, have a resume, go through an interview process.
So similar to PT and OT school.
I found it actually like a step above in the application process, like a step more challenging than if you were just applying to a typical job. But if you really take time to put into it, then it's a good learning experience too, but it wasn't unmanageable, I didn't think.
No, it just takes time, but if this is something that you're passionate about, then it'll be worth it in the end. I think Maddie would agree. This isn't a walk in the park of a year at all. It's pretty challenging and it makes you really think. But if you're passionate about it, then go for it and you're going to be really thankful about it. I think I kind of said some of the stuff in an above answer about why I chose Creighton, but Maddie pretty much said it all with the high caliber faculty and ethics, and you just knew what you were going to get. You knew the instructors were going to want you to succeed, and they were going to give you any and all resources, even if it overwhelms you sometimes, to help you get there. So I'm pretty excited and happy with my choice, even though my sleep has decreased.
And I guess we probably should mention too, you may be asking like, why doesn't everyone do a residency or fellowship? There's all these great components.
Yeah.
For me, the one downfall that it has is, just so you know, for us to be honest, is it is a lesser salary because you are gaining that further education. And then, less sleep, but it's a huge learning experience, and it's it's been a great process for us, and I don't think either of us would have changed our mind.
I don't think so at all.
Yeah.
That's kind of the only downside I would really think about. So.
But we're making it work.
Yeah.
So it's worth it. Very last question, then we'll wrap this up, is just what would our advice be if students are looking into being a candidate for a fellowship or residency program? One thing is just be involved in your student organizations and your campus, any service opportunities that you can get involved in, any additional research opportunities you can, because in applying to one of these programs is they want to see that you are a self-directed learner and that you're really passionate about the profession, and being involved in both of those two things, or showing that you are a candidate in those two things, is just how you kind of live your life right now while you're in school. Yes, school is hard. Yes, school is time consuming, but being in the Neuro Club is a good step right there. So
I would agree with that. If you guys have any more like specific questions, feel free to email us. We don't want to go on for days about advice of it, but like I said before, if this is something that you're passionate about, make sure you tell that to everyone who can listen, and make sure your application says that. And even though you want to be well-directed in that specific practice, like make sure you're showing that you're a well-rounded individual, and again that you're caring, yes, about this profession, but you're not going to forget about the others, and you're going to contribute your knowledge across all spans. So I think that's basically it. Yeah. Yay, Neuro Club. I'm so glad it's still running.
Woohoo!
I helped make it like a year ago, and it was my pride and joy.
Well, thanks for listening to us. And again, like Jacqueline said, let us know if you have any questions. Sorry we couldn't be there in person, but we are excited that you are interested in neuro.
It's a great field.
Yeah.
Hopefully we'll chat with you soon.
All right. Bye.
Bye, guys.